Hello, beautiful mama. Now, these are 3 different things that you may be doing incorrectly with your baby when it comes to reaching. I know that there's simple little mistakes that we might be making. I wouldn't even know if I wouldn't have been in this profession. So that's why I'm here to empower you and educate you. And I'm Adriana. I'm a pediatric occupational therapist of 13 years. I have 2 little ones, one little one in particular who has some developmental delays, and also the first year of life was very difficult because he had pretty bad feeding issues. Luckily we sorted it out. But other than that, I know that the first year is super difficult and hard, and so that's why I created this channel, and I'm hoping that you guys subscribe in order for you guys to feel empowered, in order for you guys to also help establish a really solid foundation for your baby so other issues will not come up in the future. Let's talk about our first little mistake that we might be making, and I'll let you know what we can do instead. Number 1 is whatever you want the baby to reach, make sure that you're placing it in the chest area. Why in the chest? Because the baby needs to look down, and this is the area where they're going to be bringing their arms and hands in midline. This is midline here. So that's why it's really important to make sure that we are not dangling the object all the way up to here where their eyes are looking back, but more so looking more downward, because this is exactly how they're going to be reaching, and this is exactly how they're going to be exploring objects. Tip number 2, try not to open up the hand forcefully. So why is that important? Because we need to understand and remember that babies have a grasp reflex right here, and they automatically close the palm of the hand. And why do they do that? It's an automatic response in the brain. They don't do it voluntarily, it's involuntarily. Later on it will integrate, and I have a video here on baby reflexes, so check that out, and in particular the grasping reflex and why we have that and how it helps. So other than that, make sure that we're not placing the hand or finger or object and forcefully opening it up, but rather simulate the back of the hand and having the baby open the hand, and then you could go ahead and simulate the hand with an object or the toy, because you're stimulating the back hand, and that will help the baby open up that hand automatically. That's how you can teach the baby how to reach and grasp. And number 3, last but not least, is when I've seen time after time that parents end up putting an object, up at near the face, and they're like dangling it around, and the baby's like, okay, I don't have eye control. Hold on. Let's go ahead and not dangle it so quickly. If you guys could do a black and white picture or a toy, or just contrasting colors, then that's totally fine. That's great. But make sure that you're not dangling and overstimulating the baby per se, especially if you're trying to work on reaching, because reaching, what happens is that we need to make sure that the object is still and letting the baby know that there's an item there in order for them to register and give them time to register, especially when you're having the object near the chest. Their eyes need to calm down, which actually takes some time, and then eventually they start moving around their arms. They don't necessarily have to be reaching towards the object. Even them just moving around their arms and looking at the object actively, that's a win-win situation already as it is when it comes to teaching the baby how to reach. And that eventually will end up leading to the baby bringing the arms and start batting the toy. So I think overall it's really beneficial for your baby to start doing this. I also have a bonus tip for you guys. Make sure that any toy that you guys end up utilizing for reaching with your baby is nice and light. So I have my favorite reaching toys up here, so check that out. And the last thing that I really want to talk about is the milestones. So between 2 to 6 months, This is when they're progressing and reaching. This is how they're progressing on how they are coordinating their arms and coordinating their eyes. So hand-eye coordination and the progress through that. And check out this video up here on the progression of reaching. So that way it could give you a better idea on where your baby is at in terms of the reaching milestone. I hope that this video was very helpful for you in terms of how to help your baby reach. So subscribe to my channel and hit the notification bell, and I will continue to see you in the near future.